It's important nowadays to know that non-small cell lung cancer, especially the non-squamous non-small cell lung cancer, is a very heterogeneous disease. Around 5% of all patients in Western countries do present in their tumor cells a rearrangement that we are called the ALK rearrangement. And in these patients, ALK translocation, the ALK rearrangement, is driven the carcinogenesis. And in fact, it was observed that these patients present tumors that are quite sensitive to ALK inhibitors. We are talking about around 5% of all patients in the Western countries. But if we take into consideration only the non-smoker patients, you can detect ALK rearrangements in even 15% of these patients. So it's a number that we need to consider that these patients are not so rare. Currently, there are many ALK inhibitors in development, and in the study I have presented today this morning, it's called ASCEND-4 trial. It was a trial that investigated for the first time a second generation ALK inhibitor called Ceritinib versus chemotherapy. The chemotherapy regimen was cisplatin or carboplatin plus pemetrexed, followed by pemetrexed maintenance. And this regimen is considered as a standard of care in many countries. In these patients, we need to stress that around 30% of all patients presented brain metastasis, and 40% of these patients had been submitted to previous radiation therapy. But 75%, or 3 out of 4 patients, presented active brain metastasis. The trial has randomized 1-to-1 these patients between these 2 types of treatments, and the trial, in fact, was a positive trial because the primary endpoint of the study, the progression-free survival, was achieved because we have observed a better progression-free survival in those patients treated with Ceritinib, 16.6 months, in comparison to 8.1 months in those patients treated with chemotherapy. It corresponded to a 45% reduction in the progression disease risk. The benefit of Ceritinib was also demonstrated by a higher response rate, 72%, a higher response rate in the brain metastasis, 72% also, and a very good and impressive results in terms of progression-free survival in those patients without brain metastasis, 26.6 months. The quality of life was better for those patients treated with Ceritinib in comparison to chemotherapy. We do not have until now the overall survival data, and it is expected for 2018. One important aspect of this study is the toxicity, because around 60% of patients presented some toxicity, especially gastrointestinal toxicity, nausea, vomiting, and diarrhea. But the majority of these patients presented grade 1 or grade 2 toxicities in terms of GI toxicities, and most of them were manageable and acceptable. If we consider the patients who needed to stop the treatment due to adverse events, the number was 11% for chemotherapy versus 5% for Ceritinib. So it's an important result also.